Hi, everyone. Thanks for joining us today. In just 5 weeks, kids in Utah will start to head back to school. This comes as COVID-19 cases and hospitalizations in Utah are on the rise, and as more counties are rated in a high COVID transmission level. Right now, nearly half of the counties in Utah fall into this high transmission level, which is the most we've seen since early March. Also, 5 weeks is the amount of time it takes to reach full immunity after getting the Pfizer COVID vaccine, which is the only approved vaccine for children at this time. We have 3 experts joining us today. Dr. Andy Pavia, he's the chief of the Division of Pediatric Infectious Diseases at U of U Health and the Director of Hospital Epidemiology at Intermountain Primary Children's Hospital. Dr. Tim Duffy is a pediatrician and associate medical director for Intermountain Healthcare's pediatric service line. And Dr. Michelle Mateo, she's an infectious disease physician at Intermountain Healthcare. She will be leading the Spanish portion of this press conference today. So first, I'd like to start with Dr. Andy Pavia. Can you start by explaining the importance of COVID vaccines right now and returning to school safely, and also what the fall could look like if children don't get vaccinated?
Well, good afternoon, and thanks to everyone for joining us. Yeah, it's a pleasure. What I want to do is just start by giving you some background. We've talked about this many times before, and then we'll field questions. This is a really important time to talk about protecting teenagers and those over 12 as they go back to school. Part of that is for the reasons that Kylie mentioned. We're seeing a very significant surge in disease. We're seeing, and a lot of it, virtually all of it, is due to the Delta variant, which is much more transmissible. What that means is the picture this fall is going to be very different than we thought it might be when things were looking better. And there's going to be a lot of concerns about transmission in school. Now, there's some good news that I want to start with, and that is that about 38% of 12 to 18-year-olds in Utah have gotten their first dose of vaccine. That puts us ahead of most states. It's really good. It's one of the only places we're ahead of most states in COVID statistics. And that shows the enthusiasm that many parents have had for protecting their kids. But 38% is not nearly enough. We've got a long way to go. As Kylie mentioned, if you want your kids to have adequate immunity on day 1 of school, now is the time to start the series. The good news is that they can get COVID vaccination with their other vaccines. That's no longer an issue. Many myths surround COVID, particularly COVID in children. And I think you've seen a lot of the attention to where those myths come from. A lot of them are maliciously spread. A lot of them are deliberate disinformation. So let me bust a couple of those myths right now. First myth, the one that drives me the most crazy, is that COVID's no big deal for teenagers. Ask any physician at Primary Children's who's endured the last 16 months what COVID looks like for that group of kids who get sicker and are hospitalized. Talk to primary care physicians about what it's like for children to get long COVID and really struggle with recovering from the symptoms. We've had about 1,000 hospitalizations. We've had a few deaths, but I think for most people, those aren't really the considerations that they think about when they think about their kids. I think what they really think about is what's life going to be like for them, whether they're vaccinated or unvaccinated. And if they are vaccinated, they will be able to participate in many activities. If there's an exposure in their classroom, they probably won't be quarantined. If the vast majority of kids in their school are vaccinated, their school probably won't have to close down when there are outbreaks in schools. And I think outbreaks in schools are virtually inevitable, unfortunately. With limited use of masks after the legislative special session, we've set ourselves up for a very difficult school year. But with Delta and with the rising case rates and with cold weather coming that will force more people indoors, I think we expect a lot more disease to be happening. What we've seen is that more of the cases that are being diagnosed around Utah are in people 15 to 45. More of the hospitalizations are occurring in that age group. So there's a lot of benefit to getting vaccinated. There are other myths out there. The myth that there's an impact on fertility, that is 100% total hogwash. And I'd use a stronger term if we weren't recording this, but it is being actively spread. If you followed the news, there are just a few groups that are seeding Facebook with a lot of this disinformation. And then, somebody sees it on Facebook, they spread it. And because you heard it from your friend, it seems trustworthy, but it may have started from an active anti-vaccination group or even a Russian disinformation campaign. Another myth that I want to bust is that vaccines don't work in kids. In fact, they work better in young adults than they do in older people. The efficacy in the Pfizer trial against significant disease was 100%, very similar in the Moderna trial. Last myth is that it's really not safe for kids to get vaccinated. The side effect profile is virtually identical to adults. The new issue that's come up that we should probably talk about is myocarditis. This is a rare side effect that does seem to be linked to the vaccine, more common in men but under the age of 30, but it is extraordinarily rare. For every case of myocarditis that might occur with vaccination, it's estimated that they will prevent some 14,200 cases, about 400 hospitalizations, and 3 deaths. We've seen a few cases of myocarditis that have not been serious. People recover well, and it's a very rare side effect. Last thing I want to mention is the way people think about risk. Vaccines carry small amounts of risk with them, but so do many things we do. The benefits are much, much greater. You think about airbags. Every year, 3 to 4 people die from an airbag going off in a low-speed collision, but about 2,800 lives are saved. So 2 to 7 versus 2,800. And I think with vaccines, it's the same thing. So I'm going to stop there and turn it over to Tim to talk about it from a pediatrician, the perspective of someone in general practice. You're on mute.
Thanks. Yep, I know. Thanks, Andy. Or Dr. Pavia, sorry. It's really, I'm in the unenviable position to follow you after you pretty much covered a lot of the topics I was going to cover. Just wanted to echo some of the thoughts you said. We're on the front lines in general pediatrics, and it's not just if you work in the hospital, you see the bad outcomes from COVID in children. We've had several kids in our practice that suffered from not the initial symptoms as much as they did the multisystem inflammatory syndrome that Dr. Pavia, is associated about a month after they have their initial symptoms. And so we have had a couple kids in the ICU from that. So a very significant burden. We've had family members that have been lost, and children have had to deal with some of the ramifications of that in the younger adult population. And so those are the main takeaways. Definitely not a benign disease. I'm glad you covered the myocarditis topic. That comes up all the time. I use a different analogy. I think I like yours better because you actually have numbers, but I think some of the parents, they're hesitant. And a lot of times, since there's so much information out there, they're not sure who to trust. And so we tend to, they do tend to trust their primary care physicians. So I would encourage you to go out and make appointments, or talk during your well child exams about not only vaccinating your children, but yourselves, because that's a conversation that comes up a lot for me, is the parents are also holding off. I like to really focus on what you had already mentioned, which is, hey, you guys can get back, your kids can get back to school. They're most likely not going to be wearing masks. So if they have an exposure and you don't want to keep quarantining them over and over again, you need to get that done now. So I think that's really important that you covered that. Trying to think, most parents though that are hesitant, it tends to be more of an emotional decision, not a logical decision. And that's why I think it is also really good to talk to someone that knows you personally, because I think those numbers are all out there. I think people see them, they're not sure, what's true, what isn't, and to have their healthcare provider interpret that for them, in the context of what's going on in their own families, I think is huge. But I think pretty much all the pediatricians and family practice docs, APPs are on board that it's still, although there is some risk, it's very, very low. And it is definitely less than exposure in that specific age group for natural disease. So I think that covers it. Andy, you pretty much covered everything. So I just had to add in a couple of things.
Yeah, sorry, Dr. Duffy, but I do think one thing we've learned is that people really do want to hear it from somebody they know, their primary care doc, and particularly their pediatrician. I'm a talking head to most people, whereas when you're sitting in front of Dr. Duffy, Dr. Tim, that's a really trusted source because he knows your kids, and that's where we're going to make a big impact, is really by having people go to people that they know to get reliable information rather than Facebook and Uncle Ernie.
Thank you, Dr. Pavia and Dr. Duffy. We're going to open up this portion to the media. If you have any questions, please put them in the chat. I'd like to ask the question mostly about the Delta variant. Dr. Pavia, do we have any information yet about whether the Delta variant is impacting children differently than the original COVID virus?
We're still learning a lot about Delta. What we can say is it's infecting many more children and young adults than older people, but a lot of that probably has to do with the fact that we've done very well at getting vaccine into our older age groups. So right now, when we've got a lot of disease occurring, it's going to hit those who are not vaccinated, and those who are not vaccinated are children. Is it causing different symptoms or different manifestations in children? We don't know that yet. There are a few people at children's hospitals who seem to think so, but that's not based on any reliable data.
Can we talk a little bit more about returning to school in the fall and what that could look like if the number of cases keep climbing? The last 2 days, our case counts have been almost 700, which has doubled in the last 2 weeks. How concerning is that to both of you, Dr. Duffy and Pavia?
Tim, why don't you lead, and I'll.
Yeah, it's good. And I see some other questions in the chat as well. I mean, it's really concerning. I mean, I think especially when we have a vulnerable population under 12 that can't be vaccinated. I mean, I personally would like to see kids wearing masks in school, especially in that age group. So I don't know, Andy, what do you think?
So I think Utah has a lot to be proud about how we manage schools after we had a steep learning curve in the fall. But after we got through it, we really did a very good job of letting kids have in-person education and keeping it reasonably safe. And we did that with mask use, with testing for special events and after exposures, and trying to increase ventilation, and by responding when there were cases early on. In an ideal world, what we would do is we would have everyone who can't be vaccinated or who isn't vaccinated mask when they're indoors in the classroom. And we would vaccinate as many of the kids who are eligible as we could. And if we did that, school would be about as close to normal as we can make it. Unfortunately, the school districts and the local health officers have had their hands tied. And quite frankly, many of us are very upset about that and worried.
Okay, we have a question here. Please talk about whether children should be wearing masks when they return to school, especially those too young to be vaccinated. And also, what about the delay in getting approval for younger than 12?
So this becomes a matter of opinion. Wearing masks is still something you can do. My kids are vaccinated and they're young adults, so I don't have to deal with this. But when I talk to my friends and colleagues who are pediatricians whose kids are going back to school, who are between 6 and 12, they're going to have them wear masks to school. And I think that's something people should really think about quite seriously. As for vaccine in the 6 to 12-year-old age group, we just heard an update that it looks like the trials are on track to have a readout, that is data on whether it's safe and effective, sometime in the September-October range. And then it's going to take some time for FDA and the advisors to really carefully look at all of that information. So we anticipate somewhere around the new year, hopefully a little bit sooner than that. But there's, I think the fall for kids 6 to 11 is going to be one without vaccine. And hopefully the winter will have vaccine available.
What impact do you expect outbreaks to have on hospital capacity? Will there be enough staff to handle potential surges?
Well, I think we will cope. We have coped. The question is, what's the cost going to be? Already, with the surge we've had without the hospitalizations peaking, the ICUs in many of our systems are operating at close to 100%, and we are experiencing real staff pressure. The biggest staff pressure is a human one. We don't talk about that enough, and if you know, it's like being a soldier. If you haven't been to war, you don't know what it's been like for our colleagues in the ICUs who've dealt with this for 18 months. And quite frankly, they're burned out. Many have left the profession. We are worried about what will happen if things get a lot worse than they are now.
Here's another question from Nick. This one's a little controversial. It says, what extent is Facebook responsible for allowing these small number of anti-vaccine messages to spread and gain traction? Maybe a better way, how do you help your patients with misinformation that is spreading on Facebook and social media?
I think I can take this one because this comes up all the time. Matter of fact, usually in the morning, I'm scrolling through the Facebook feed to see what questions will be coming at me today in clinic. And, you know, it's really important that we stay ahead of it because there is so much misinformation. I don't think we can blame it on any one social media service. I think there's information out there, people want to be heard. And if we try to suppress it, then that makes it even more interesting. And then different social media outlets pop up. So I think it's more, you know, you have to have that conversation with your physician and just be open. You know, just say where the source was of the information. So I'd really encourage people to make an appointment and see their physician, whether it's a video visit or in person, or, you know, the people that they trust, to really kind of filter that information. Because sometimes there's information on Facebook that's accurate. And, you know, we like to confirm that information as well. So
I try and tell people that the internet can be a really good source of health information, but social media is generally terrible. There are lots of trusted sources that you can access. You know, here, there's really good information on the Intermountain and University websites, at the Utah Department of Health. Nationally, there's Mayo, there's CDC, the American Academy of Pediatrics. Lots of people are putting out good, thoughtful information. But Facebook functions, you know, as a giant game of telephone. The information enters at one end, gets passed on without any checks on its reliability. So it's probably the worst place to get your health information, which isn't to say that people shouldn't be learning and educating themselves. Just please do it from primary sources, reliable sources, and then double check it with someone like your pediatrician.
We're streaming this live on Facebook right now, and we have some questions. How bad will this be in the flu season? I'm guessing they're saying COVID-19. That's what they might mean in the flu season.
Well, maybe, Tim, you want to start with what it would be like if, in practice, if you had bad RSV and bad flu with COVID still around.
And unfortunately, we're pretty much anticipating that. I mean, the big thing is trying to keep space between these, because a lot of times these are the younger children that aren't able to be vaccinated, and we need to protect, you know, everybody that comes in. So there's, you know, we have to be creative about how we separate healthy visits from sick visits. And then the sick visits don't all have the same thing. I mean, that's the biggest issue. We don't want kids with RSV, you know, swapping, you know, coronavirus with the kids sitting next to them. So it definitely, you know, it makes a lot of challenges. But as physicians, we want to be there for our patients. We want to be able to see them. You know, last year, a lot of things were shut down and we couldn't even see our own patients, which was frustrating. That is not the plan. In the Intermountain clinics, we plan on seeing our patients, but we have to do it safely. And so there's going to be a lot of work this winter.
And from a hospital perspective, it's really a capacity problem. a lot of winters, we have RSV and flu to such a degree that we exceed our normal capacity. We put 2 kids in single rooms at primary, and we have mandatory overtime for people. And, we don't sleep for a few weeks at a time. If you add COVID on top of that, it could be very difficult. Now, our ability to predict what's going to happen is terrible. We don't know. But with flu having been gone for a year and RSV been having gone for a year, our best guess, and it's just a guess, is that they will be back with a vengeance.
We have another question on Facebook. What percentage of COVID vaccination in a school would be recommended in order to go back without masks?
I don't think we can give a number which makes it safe for the unvaccinated kids. But I think that if we get a very high percentage of kids vaccinated, then those who are vaccinated certainly don't need to wear masks. The teachers will be protected. And remember, a lot of our teachers are older and have health problems, and they're vaccinated, but vaccine's not perfect, so we'd like to protect them. I think that ideally, you would still mask if you're unvaccinated, because you're still at some risk, although you'll be more at risk when you're out in the community among unvaccinated people than when you're in a classroom if most of your classmates are vaccinated.
Okay, we have a question from Deseret News. How much of an impact will children returning to school in the fall have on surges in infection?
You're not jumping up for these crystal ball questions. We always are very cautious in these predictions because this virus has surprised us at every turn. Last fall, when universities opened and then when schools opened, it drove a big surge throughout the community. Logic would say that's what we're facing and that's what we're worried about. And we'll just have to see. If by some miracle, we could get our vaccination rates up by another 15 or 20% so that 60% of kids 12 to 18 and 80% of adults were vaccinated before school opens, it could go really, really well. But that's a big lift for us to get there. So I am worried. I'm very worried about September.
Yeah, and just to add, last year we had a situation where that age group, like Dr. Pavia said, they really drove the beginnings. And then what happened was a lot of the older population, they want to see their families for the holidays. So by the time the holidays rolled around, we had already kind of started things off, in these younger age groups and the college age kids. And if we could get them vaccinated, I'm hoping we can prevent that. And hopefully those grandparents are vaccinated as well and prevent, our poor adult colleagues who really, as Dr. Pavia suggested, really were overwhelmed last year. It was really tough to see them when you walk by them in the hospital. They were just demoralized come January and February.
We have another question from Facebook. For children under 12 years old, since we won't have vaccines and most people won't be having their children masked, is the only safe option homeschooling?
This comes down to individual decision making, I think, and I'd be curious about Tim's perspective on this. I think if your child masks reliably in school, and if the school is, we know our schools are good at this, if they're vigilant about not having a lot of mixing and trying to have good ventilation and spacing, it will mitigate the risk a lot. But if you really want to protect your kid absolutely from being infected, particularly if your child is at very high risk because of their heart or lung disease or cancer, then, homeschooling would be, school at home, whether it's with remote learning from your school or by homeschooling, is probably the safe option.
Yeah, I think from a general pediatric standpoint, I'm starting to get more and more concerned about the number of years that kids are out of school. So we have to, I just really wish we could get back to normal and I just really need people to get vaccinated, honestly, because I don't want to keep the kids out of school any longer. because I think missing 2 years of, schooling in person and the social aspect, I think it will have effects down the road. And I just would really implore people to vaccinate so we can just send kids to school safely.
And remember, because of the new legislation, schools can't mandate masking, say in a fourth grade classroom, but there's no reason that the kids, their parents, and the teachers can't band together and do the right thing and say, hey, let's mask so we don't end up having shutdowns and quarantines and miss another year of school.
Okay, it looks like we have one more question. If you have a question, please put it in the chat on Zoom or in the Facebook chat and we'll get to it. But from ABC4, we've seen recent outbreaks at summer camps. Is ramping up testing of kids something you would endorse as a way to prevent potential outbreaks in schools?
Testing is definitely one of the tools in our toolbox. And we do best when we have layered protection. And testing used appropriately, along with masks, along with spacing, along with ventilation, can really add a lot. I do worry that we can't test our way out of this. To do so would be really rough on kids and probably wouldn't be incredibly effective. People have suggested that if you test twice a week, you can interrupt a great deal of transmission. But imagine the impact that has on school if they are devoting a lot of resources to testing everybody twice a week instead of teaching. And of course, it's not going to be popular to have kids have to spend time collecting saliva or having a nose swab twice a week. So I think testing is a tool. We need to use it, but it's not a substitute for the other things, the other layers that we need to use.
Thank you. We're going to wrap this up, but Doctors Duffy and Pavia, I just wanted to give a little bit more time to you with a message that you can give to parents right now who may be deciding or who don't want to give their children permission to get the vaccine. What would you tell them?
I would say that before you make that decision, go in and talk to your provider. Don't make that decision on your own based on what's probably misinformation and legitimate fear or lack of information. Get all the information you need to make a good decision.
Yeah, and I would just like to echo what Dr. Pavia said. You have to get the information from a source that you trust. And I'd strongly suggest, if you're not planning on vaccinating your child, that you speak with your physician about it, because we can hopefully dispel a lot of the myths, and ultimately we'll support families in whatever decision they make. But it's really, we really would like to see a higher percentage of kids vaccinated so we can get back to normal as soon as possible.